Today I'm interviewing Chris Potter, Director of Community Programs at Manningham City Council. Chris, councils in Victoria have a unique role in provision of healthcare services. What does Manningham do in primary healthcare?
Well, for us in primary healthcare, we, particularly under my role, I guess we do a number of things. We lead on aged care and disability services, for example, but probably not more towards the health side, more towards the sort of social support side. So we're really looking at things like going into homes and helping people stay independent in their homes through the home and community care service provision. Also provide disability services to young people and school holiday programs. And then I guess the other area is really a much broader social policy and social and health policy. So really looking at the whole aspect of health and well-being. And as well as that, we run a couple of particular direct services as well. So maternal and child health services, early years, and some of the inclusion support services for families that have got more disadvantaged kids. I guess so there are a broad range of services that sort of typically fall under the broader health arena.
So given that really wide range of services, how does Council connect with the rest of the system? So for example, general practice.
Well, in terms of general practice, I guess our connection in would be some of the partnership working both with the Medicare locals currently and also with the primary health networks in the future. We probably don't have a direct relationship with general practice particularly, but it's through those partnership networks. So, we're very keen to have more of a sort of holistic approach to health, and that really includes some of the direct health elements through GPs. We also have relationships with hospitals in that regard, but also we're looking at, I guess, the whole of the social and health environment as well. So it's not just directly around health services, but it might be around the environment, around the built community, social and affordable housing. So a lot of those aspects that do have an impact on health, we develop partnerships in all of those areas.
So what are the three big issues for the Manningham community?
So the three big issues for Manningham are really around family violence and also around diabetes, particularly in young people and males. And the third one is really around social inclusion and social connectedness.
You mentioned Medicare locals and primary health networks, and I know you've been quite involved personally in the rollout of Medicare locals and now the development of primary health networks. What do you see their role in working with Council to address those issues that you've just identified?
I think it's about a number of different partners getting together, and I see certainly the Medicare local and also the primary healthcare network in the future really playing a coordinating role and also a leadership role with Council and with other partners. And I think the reality is that the sort of environment we're in now is fairly tight financially, and some of these things are only going to get delivered and achieved through effective partnership working. Yeah.
And how do you see the PHN working with Manningham City Council to address those issues?
I think it's really key that there's a strong working relationship and partnership between the PHN and Manningham City Council and other key partners. So building on, for example, the Social Issues Council that's been established recently, which is sort of drilling down and dealing with those issues. And also, secondly, I think going into the PHN environment, the clinical councils and also the Innovation Council will be really strong in that area, I believe. What
do you see as the challenges for a new primary health network setting up in this changing environment?
Look, I think one of the challenges, and this is not necessarily in every PHN, but certainly for the one in the east, is the geographical boundaries and the extent of the area that they cover. And I think in those circumstances, it could be very easy to have specific area focused services or attention, and then you get into the danger of potentially having silo delivery as well. One of the benefits I think that the PHN brings is to actually move away from that siloed position and to have some sort of interconnectedness. So I think it's really important around making sure that doesn't happen and that all of the agencies work together across the whole of the municipality that's being dealt with.